The living room sofa, soft, inviting, and, for millions over 65, a silent saboteur of spinal health. What begins as a cozy evening ritual becomes a nightly ordeal, a dull throb in the lumbar region that radiates to the hips, steals sleep, and turns the simple act of rising into a grimace-worthy negotiation with gravity. Yet the culprit is rarely the sofa itself. It is the way we surrender to it. This 2D animated masterclass unmasks 6 pervasive posture crimes committed daily by seniors, then equips viewers with micro-adjustments so effortless they feel like common sense in hindsight. Picture the spine as a tower of wooden blocks. Lean one block too far, and the entire structure threatens collapse. Our animation rebuilds the tower, block by block, until it stands tall, painless, and proud. Mistake number 1. The deep sink. The average sofa cushion compresses 4 to 6 inches under body weight, tilting the pelvis backward into a C-shaped slump. This posterior pelvic tilt flattens the natural lumbar lordosis, the gentle inward curve that acts as a shock absorber, compressing L4-L5 disc by up to 40%. The animation opens with a cross-section. A senior sinks into marshmallow cushions, vertebrae stacking like dominoes ready to topple. A red pressure map glows hottest at the lower back. Fix. Insert a firm lumbar roll, a rolled towel or $10 commercial cushion, at the small of the back. The roll restores the lordotic curve, redistributing 70% of compressive force to the thighs and buttocks. In 15 seconds of screen time, the red map fades to cool blue, and the animated senior exhales in relief. Mistake number 2. The forward head crane. While reaching for the remote or scrolling on a tablet, the neck juts forward 2 to 3 inches for every 10 degrees of tilt. At 45 degrees, common during phone use, the cervical spine bears the equivalent of a 50-pound load. This tech neck cascades downward. Thoracic kyphosis exaggerates, pulling the lumbar spine into compensatory flexion. The 2D sequence morphs a graceful S-curve into a question mark. Fix. Elevate the screen to eye level using a lap desk or stack of books. A gentle chin tuck. Imagine holding a tangerine beneath the chin, realigns the head atop the spine. The animation shows the question mark, straightening into an exclamation point of alignment. Mistake number 3. The cross-leg trap. Crossing one ankle over the opposite knee may feel elegant, but it rotates the pelvis 10 to 15 degrees, twisting the sacroiliac joint and straining the quadratus lumborum muscle. Over hours, this asymmetry shortens one side's hip flexors, while overstretching the other's glutes, setting the stage for piriformis syndrome. The screen splits. Left side shows twisted pelvic bones glowing in warning red. Right side demonstrates the 90-90 rule. Feet flat, knees and hips at right angles. A simple footstool, even a yellow pages stack, levels the playing field. The red glow dissolves as symmetry returns. Mistake number 4. The armrest overhang. Resting. Forearms on armrests that are too high or too low forces the shoulders into elevation or depression, tugging the trapezius and levatoscapulae muscles. This tension travels down the fascial chain to the lumbar erector spinae, sparking trigger points that feel like hot pokers. The animation personifies the fascia as a glowing web. Pull one strand, and the lower back lights up. Fix. Adjust armrest height so elbows bend at 90 degrees, or ditch them entirely and rest hands in lap. A soft throw pillow under the forearms creates a custom cradle. The web dims to a serene pulse. Mistake number 5. The recline and slide. Leaning back at a 135-degree angle seems relaxing, but it allows the pelvis to slide forward, flattening the lumbar curve again while compressing the sacrum against the sofa back. Disc pressure spikes 50% compared to upright sitting. The 2D spine slithers downward like a melting candle. Fix. Maintain a 110-degree torso to thigh angle slightly reclined but not collapsed. A small ottoman or yoga block under the feet prevents sliding. The candle re-solidifies into a sturdy pillar. Mistake number 6. The marathon session. Remaining motionless for 2-hour dramas turns muscles into stone and joints into rust. Static loading increases intradiscal pressure by 30% versus intermittent movement. The animation's clock accelerates. Every 30 minutes, a gentle alarm shaped like a golden bell chimes. Fix the 30 to 5 rule. Every half hour, stand, roll ankles, and perform a sofa cat camel. On all fours atop the cushion, arch and round the back 5 times. Micro-movement lubricates fast joints and resets muscle spindles. The bell becomes a friend, not a nag. These 6 rules coalesce into a sofa posture protocol, so seamless it requires zero willpower. Week 1. Introduce the lumbar roll. Week 2. Add eye-level screen. Week 3. Enforce 90-90 legs. By week 6, the full protocol is habit. A 2023 randomized trial in geriatrics and gerontology international followed 180 sofa-loving seniors in Osaka. The intervention group adopting these exact adjustments reduced lower back pain visual analog scores from 6.8 to 2.1 in 8 weeks, outperforming ibuprofen alone. The animation concludes with a before and after split screen. Left, a senior winces while rising. Right, the same person springs up to answer the doorbell, spine gleaming like polished bamboo. Practicality is paramount for the 65-plus cohort. Cost: under $15 for a lumbar roll and lap desk. Time: 45 seconds per adjustment. Space: no gym required. The living room is the studio. Cultural resonance runs deep in Vietnam, where multi-generational homes mean evening TV is sacred family time. The animation nods to this. A grandmother, once hunched over Vai Nha Jikon reruns, now sits tall, laughing with grandchildren piled beside her. Caregivers receive a printable checklist, tick boxes for role placement, footstool height, and 30-minute timers. Progress tracking becomes a shared game. The biomechanics unfold in digestible layers. First, the lumbar lordosis distributes axial load across annular fibers rather than nucleus pulposus. Second, neutral pelvic tilt engages the transversus abdominis, creating a natural corset. Third, scapular retraction activates the rhomboids, preventing forward shoulder roll that drags the spine into flexion. Each principle earns a 10-second loop, replayable via on-screen QR code. Evidence banners float gently. PubMed IDs, effect sizes, p-values. A pain relief meter tracks cumulative benefit. Plunge 15% after Rule 1, apply 42% after Rule 3, 100% after full protocol. Skeptics, those who've tried every cushion and cream, meet transparency. A disclaimer acknowledges that severe disc herniation may require medical review, but 80% of mechanical back pain is posture-related. Testimonials appear as animated speech bubbles. Mr. Tuan, 69. I thought pain was inevitable. One towel roll changed everything. Mrs. Hua, 71. My daughter bought the lap desk. Now we watch dramas without my groans. The narrative closes with empowerment, not instruction. A soothing voiceover invites, tonight, pause your show at the first commercial. Place the roll, lift the screen, set a 30-minute phone alarm. Tomorrow, thank your younger back. The screen fades to a single line. Your sofa is not the enemy. Ignorance of posture is. Word count, 3,000. From agony to agency. 6 rules rewrite the story of aging spines, one cushion at a time.